Welcome, everyone. As you start to join us, I want to let you know you're in the right place with Operation Parent and Captain Michael King to talk about opioid prevention and how you can utilize that in your home as well as your community. So, thank you so much for taking some time out of the middle of your day and spending it with us. We feel honored that you would do that. So we've got a really great crowd coming in today. So as people are coming into the queue, just want to let you know we've got a couple of upcoming webinars that you could register for at your convenience. This next one is on behavior modification in March with Dr. Crystal Coyer. So if you have attended our webinars in the past, you may have attended one with her. She's coming back again to speak specifically about how to modify um, really any behavior, but she'll touch on specifically risky behaviors that might come up with your teens. That's going to be on March 14th at 1 p.m. So hope that you could put that on your calendar. And just remember, as you share it with your friends, you can remind them, even if they're not able to join us live, if they could register in advance, they could listen to the recording later in the evening. So that's available up at operationparent.org. Operation Parent's mission is to love and support parents by providing real-world information, connection, and most importantly, hope. I'm going to let you know a couple of ways that you can utilize the system while you're here with us today, how you can participate, because we love hearing from you, especially at the question and answer section at the end of the presentation. So if you look at that orange arrow at the top of your screen, if you click on that, that's going to open your control panel all the way up. And you can view all the features. One of the features in that control panel is your question section. So all attendees are going to be muted during the presentation itself, but we would really look forward to hearing from you in that question section at the end. You're going to send us questions there, type them in and send them to us. Just know they come to us privately. So you're able to submit your questions there anonymously. And once you type in your questions and send them, we will get to as many of those at the end of the program as we can. So we'll do our best to speed through those. We typically get more questions than we can get to, but hopefully we'll get to all of them today. We'll definitely do our best. We have put together some awesome handouts for you today. One of them is has all the links of resources and places that you can go to do further investigation and study after the presentation. So that's a Word document that has active links where you can go and dig in on things after we close today. The other one is the SAMHSA Opioid Overdose Prevention Kit. We're going to guide you specifically to page 5 there. So if you've already downloaded that and you want to pull up page 5, that would be great. We've also got some information there about the Rural Opioid Technical Assistance Center. So if you're coming to us from a rural community today, please get focused in on that handout. We have saved the date for our future webinars. So if you wanted to share that with your school or your organization or throughout your drug-free community, you could, and folks would know about our upcoming webinars. There's also a PDF of today's slides. So I know many of you like to print that out and follow along with us. So that is available if you're new. Know that that's something that we try and provide each time. You can download them right here in GoToWebinar. And we also tried to send you an email this morning at the email that you registered with that also contains the handouts. So if you're on your phone and not in a place that you can download right now, don't worry, you've got those in another spot that you can get to later. So as I've said, the Q&A is going to happen at the end of our presentation from Captain Michael King. You're going to get a certificate of attendance that's going to be attached with your survey at the end. The short survey is sent to you directly immediately when we close the webinar. It's only going to take you about 2 minutes to complete, but your continued support, encouragement, and constructive feedback on that survey is so appreciated, and it's really what keeps us going and helps us design um, future webinars and our prevention tools. So again, you are going to get that certificate, but I also want you to know you're going to get a recording. So following the close of our session, we will download the full presentation, and you will receive a recording link. You're going to need to check your email and make sure that it's the email that you registered for the webinar with. So now on to the great business of today. I get the distinct honor of introducing you to Captain Michael King. We had the opportunity to meet at the Louisville Opioid Summit a little ways back, and he's the perfect person to talk about opioid prevention in our communities. He's focused on emergency response every day in his work. He understands that the opioid crisis is an emergency and that all of our communities need to be tuned into that. I love it that his background is both social work and public health, and now you add the SAMHSA work on top of that. It's just the trifecta of someone that can talk to us and help us just understand the bigger scope of the problem, and more importantly, how we can throw some hope on it, that there's a lot of great things happening, and there's a lot of things that we can do in our own homes as well as in our communities to make a difference in opioid prevention. So thank you so much for joining us. We can't wait everything you're going to teach us.
Thanks, Michelle. And I just want to confirm we're seeing the screen. Everything's good to go on your end, Michelle.
It's
all right.
great. It looks, everything
Awesome.
is ready.
Well, it is such a pleasure to be here. I want to thank Operation Parent, and thank you, Michelle, for having me on. And I can see that we have, over 400 folks on this call, and this is going to be, I think, a very fruitful hour-ish for you guys. And because we're going to talk about overdose prevention today, there will be a focus on opioids, but we'll also talk about other substances. And the things that we're going to talk about today really apply generally to any time we're talking about substance use and substance misuse and overdoses. And if you're not really sure if you're going to get something out of this hour, I want to whet your appetite. I want to say, if you've ever had someone ask you what they could do personally right now to help prevent overdoses, then you had to think about that. Or if you've ever been curious about how you personally could make better progress and have more impact doing whatever work you do, or maybe just as a parent. Or maybe if you've ever wondered about how you could help your community do more when it comes to prevention and reducing substance use and misuse, and maybe save lives in the process, then I think you're going to get something out of the next hour, right? There's something in here for you. Now, personally, I've been working in this area a long time, and here are a few little bullets that I'm not going to read to you, but they describe some of the things that I've been doing, first at the CDC and then at the Substance Abuse and Mental Health Service Administration, or SAMHSA. You'll hear me say SAMHSA several times today. But that said, this is really about what you guys can do. Now, SAMHSA has done a lot also nationally, and we'll talk more in detail about some of the things that they've done. Specifically, the Opioid Response Network is noted here in bullet number 2, and we'll talk a little bit more in detail about what that is, but that is, for you to know, it is the American Academy of Addiction Psychiatry in collaboration with like 50 plus states and 9 territories with local consultants and local experts who are standing by to help answer your questions about preventing opioid overdoses. So I want to highlight that and flag that now. We'll talk more about it a little bit later and other things that SAMHSA is doing. But today is not so much about SAMHSA. Today is about you guys. And maybe some of you can't stay for this entire hour. Maybe some of you attended like the last session, and this will be kind of a bit of a review right at the start. But I want to begin with some easy things that parents can do right now to get started making a difference in both their lives, the lives of their kids, the lives of the communities, and they're fairly easy steps. And I say easy only because it doesn't take a lot to get informed. Now, what do I mean by informed? Well, it's easy for all of us to think this isn't going to happen to us. It doesn't really pertain to us, or our families. Maybe our families haven't been touched by addiction yet, or they haven't been touched by an overdose yet. Denial is pretty easy, but I guarantee you folks in your community have been touched by this, because we know that 1 in 4 people who actually get a legit prescription for opioids, like from their dentist or their doctor, are still going to struggle with addiction after taking that prescription. That's 1 in 4. So if you've been to the doctor for any sort of surgery, or if you've been to the dentist recently and gotten a prescription for some sort of opioid, guess what? You got a 1 in 4 shot of becoming addicted. We also know that over 70% of overdose deaths involve an opioid, right? That includes prescription opioids. And we know that for every one of those people who die from an overdose, there are many, many more non-fatal overdoses that also destroy lives. So get informed, right? This is a problem that doesn't discriminate. Doesn't matter if you're rich or poor, doesn't matter what color your skin is, doesn't matter where you live, does not discriminate. So first thing you can do, easy thing to do, get informed. More important than just knowing things, right? More important than knowing where to go get the numbers or being able to share a catchy statistic, is just knowing that the world today is different from when, say, I was growing up, or maybe when some of you were growing up. It's a different world because, for one thing, there are so many fake pills on the market now, right? Fake pills that are designed to look just like a prescription pill that you might get from your doctor or your dentist. These things are laced with highly potent drugs like fentanyl, which is a synthetic opioid, or their analogs like fake fentanyl, or fentanyl, which has been slightly changed just so that it stays legal enough that people can produce it, or even things like xylazine, which is a horse tranquilizer, which also goes by names like trank dope or just trank, or I think it's also called zombie drug or something. But they're putting this horse tranquilizer in with fentanyl, in with other stuff now, so that even taking one pill that maybe looks like something that was prescribed by your doctor or something that was given to you by your dentist, right? Even taking one pill nowadays can kill you. So the notion of like recreational use, or, oh, I'm just going to borrow one of my friend's Xanaxes or something like that, if it wasn't prescribed for you and it didn't come out of the bottle from your doctor, then guess what? You're at risk. So in fact, I think on this slide, songforcharlie.org is listed. This was an organization created by the parents of someone who died from taking one pill. His name was Charlie, and I encourage everyone to go check out songforcharlie.org. A lot of good information there. But the idea that there is no experimenting anymore. There is no just recreational trying things out, right? You're rolling the dice every time. So the world is different. But of course, you know the world's different. You've got some information, but you also have to have some tools to do the job. And there's hope, right? Like SAMHSA and others have thought about how we can help others do this. Now that you know about the new risks, it's time for some new conversations with your kids. We have a national substance use prevention campaign called Talk They Hear You, which will help you stay informed and help you take action. It'll literally teach you how to have the talks with kids. And so just to get started, you could go to our website and you could listen to an episode of the podcast, What Parents Are Saying podcast. You can check that out. That's a very easy way. You can listen to it in your car. You may, I believe, and Michelle, you can confirm it for me, that they got the 5 conversation goals fact sheet as a handout. I think so. Anyway, I think one of your handouts is that 5 conversation goals. Some of them are listed here. So things like having a conversation that shows you don't approve of using substances, or you can show you care about their success. Like have a conversation and just express that to them. You can show that you're a good and trustworthy source of information, right? By sharing some of the information that you gather from today, from this hour. You can show that you're paying attention to them by discouraging risky behaviors, right? Just having these conversations is so helpful. And finally, like making sure your kid has a plan. Maybe do some role playing with them about peer pressure and what do they say? What do they do if their friends are asking them, hey, you want to try some of this, or here, just one pill, right? Role play it out with them. Give them the skills so that they can survive those encounters, right? Like things that seem innocent may be not so innocent anymore in these days. So Talk They Hear You is a fantastic resource for you guys. Another resource that you can use on your own, it's pretty short. You know, when you see the words like toolkit, it can maybe be intimidating, but this is a fairly brief guide, our opioid overdose prevention toolkit that's available free for download. I believe it's also one of your handouts today. Is a fantastic place to check out. And in fact, some of the really good information that you're going to find in this toolkit starts on page 5. So I know that in the previous webinar, they may have covered some of the warning signs for an overdose, but on page 5, this tells you exactly what you can do if you suspect someone has just overdosed. And so I'll review these really briefly, but if you want to take a much deeper dive into this, then I encourage you to go and check out page 5 in the toolkit. But essentially, you know, if you see someone you think is overdosed, you know, maybe their lips are turning blue, they're breathing really shallowly, you know, you start to evaluate these signs. You look to see, you know, oh, they're not breathing really well, they're having trouble getting air, they're unresponsive. You can try like a sternal rub, or, you know, you pinch them lightly to see if they respond. You know, if they don't respond, definitely call 911. The 911 operator may or may not ask you to start CPR depending on your skills. But just the things that you can begin doing. Also, if you have Narcan, which is naloxone, essentially in a nasal spray available, administer that. Some things I like to remind people, this is not rocket science. It's not something that you have to have a medical degree or any sort of license to do. Anyone can check to see if someone's breathing, pull out their little bit of Narcan. If you don't have it, that's going to be the big barrier, because this may be the only thing that saves someone's life if they've overdosed on opioids, right? This will immediately reverse the effects of those opioids. Sometimes you'll need to administer 2 of these. These boxes actually come with 2 doses, depending on how much of the drug the person has on board. It may take a couple of doses, so you have to stay with the person. You can't just like dose and leave. You got to hang out until the ambulance gets there. And we know many people die because they were using alone and they don't have anyone to give them this life-saving drug. This life-saving drug is also available all over the country. In many states, it's available for free from a harm reduction coalition or from your health department. Sometimes there's a small charge depending on where you are in the country, but it's saving lives in your hands. So making sure that you have the Narcan, and pretty sure I said it, but if I didn't say it, I'm going to say it again. It bears repeating. There is no harm done if you administer this and the person did not take an opioid. If you're like, oh, I'm not sure they took what they took or what's going on. If you squirt this up someone's nose and they did not take an opioid, guess what? No harm, no problem. It doesn't do anything to them unless they happen to have used a whole bunch of opioids. And in which case, then it knocks the opioids out of there and it saves their life. So there is literally no reason not to use this if you suspect someone just overdosed. So I think that's a really important thing, because, you know, while we have good Samaritan laws, et cetera, people are sometimes nervous about administering a drug to someone they don't know, or if they don't know what happened. But that may be the only way to save a person's life. Sometimes when they wake up from their overdose, they may be angry, they may be disoriented, so be ready for that. If it really was an overdose and you just Narcan them back into life, they're gonna be a little freaked out. They may not know where they are, they may not know what's going on, they might be combative. So, you know, keep yourself safe, but the fact is you just saved someone's life. So that's what it's about. There's a lot more information in the guide. I don't want to spend a lot of time here because, you know, this is something for you guys to digest at your own pace, but I feel it bears spending a few minutes right at the start in case some of you have to drop off the call early. This is the important life-saving information that you really need to have. So those are the things that parents can do immediately. What I want to do for the next chunk of time is share with you 3 stories, because we know that prevention is better than waiting for overdoses to happen. With families and communities, we also know from years and years of doing this that effective prevention requires a few things. It requires collaboration. It requires locally appropriate action using an evidence-based strategy. So if you're missing any of those things, the likelihood of success goes down. So to help everyone on this call turn this information into some kind of action in your family or in your community, I want to share 3 examples, real world examples of overdose prevention that were successful even during the pandemic, right? When things were shut down, when people weren't able to meet, really close. When it was the most difficult circumstances, each of these 3 strategies actually continued to work and saved lives. And then I'm going to share some resources that you can use, some more federal resources that your taxpayer dollars have already paid for and created, but things that are out there that you can use today or tomorrow or next week to do a better job in your work, to help your family better, to help your community. So without further ado, let me advance my slide. The first story I want to share are about regional overdose prevention specialists, or they call them ROPES, from the Tennessee Department of Mental Health and Substance Abuse Services. And this is a picture of one of them here from their media campaign. But the ROPES are a key part of the overdose prevention plan in Tennessee. So the overall plan includes over 40, I think it's 41 substance abuse prevention coalitions all over the state, a rapid overdose response data system, and you'll hear a lot about data today. I'll mention that because using numbers is important. And then, of course, their Tennessee Together media campaign. The slide before that had the picture of the ropes. In fact, I'll go back to that. This the slide right in the middle, the nice image, that was part of their media campaign. So they like to take the success stories of these prevention specialists and share them more broadly. Oh, there we go. All right, so media campaign. And if you are a ROPE, your job is to focus on training and outreach. So these ROPEs go all over the state, providing training and outreach to 3 specific groups, in fact. The first group that they work with are first responders to make sure they're ready and equipped in case they encounter an overdose. The second group are individuals at high risk of overdose, also their families, also their friends. So they'll come out to people who've experienced an overdose or to people who help others after they've recovered from an overdose, their families. They'll go out into communities. And the third group are healthcare professionals, which see the people who've had an overdose. So these are healthcare professionals who provide treatment or recovery services and provide community resources themselves. ROPES will work with anybody, but these are the 3 main groups that they target. And since 2017, they've done over 2,000 trainings. They've had over 40,000 participants at their trainings, and just more continue because their work, sadly, is needed. Now, what I think makes them really relevant to our conversation today is that ROPES meet people where they are. And this is a great lesson for you. So just speaking geographically, ROPES are located all over the state of Tennessee. Right? They're the primary point of contact for training, for education on opioid overdose, and for prevention. And one way they do it is by distributing naloxone, right? Because if you want to prevent someone from dying, this is the way. So they go out and they talk about it, they give it out at a number of different events. But I think maybe even more important, and more important for our conversation, is that ROPES save lives by meeting people where they are in their life journey. So instead of making judgments about where they should be in their journey or what they should be doing, they're not shooting on people. They're accepting where they are and they're giving them the help they need, the evidence-based help they need. So for example, they'll attend really important community events like recovery court graduations. Like there's a picture here of them in the, I think it's the DeKalb County Misdemeanor Recovery Court graduation. And that was an event where 79 people showed up. The local prevention coalition showed up. They handed out over 100 resource guides. They gave out free masks because remember, this was during the pandemic. They provided naloxone use training for everybody. So they showed everyone how to use this and when and how to recognize the symptoms, et cetera. So that was a big deal, and they continue to do this. So this is one way that they fight the stigma that comes along with overdose and substance use and misuse. So they're out in the community and they're not judging. They're just trying to save lives because that's the most important thing. And that's what's important for us. So you don't have to take my word for it. We're going to try an experiment here, and we're going to try to play a video of one of the ropes who talks about how he got into this. And I'm going to turn it over to Michelle. Let's see. All right. Let's see. Hopefully you guys can hear me again. And let's see. Hopefully we are looking at the right screen. Michelle, I want to make sure that you're seeing the right screen.
Sound is good. We just need to maybe advance one slide. So I see your last slide with, yep,
All right.
there we go.
We're looking good. We're
Looking
back
great.
on. All
Perfect.
right. So it's always amazing when technology works the way you want it to work. So, woo.
Right. Shocking.
I know. Something to be thankful for. That said, I want to talk a little bit about Josh Cruz as one of the ropes, and the reason we picked that particular testimonial. Um, this is Operation Parent. Many of you are parents. I'm a parent. Um, if you are a parent who has dealt with addiction in your family, if you've dealt with overdoses in your family, if you are currently struggling with addictions yourself, I think the idea of compassion fatigue and the notion of just wanting it to be over and someone else to deal with it is normal. That's something that you've at least you've encountered it, and so you can understand where Josh Cruz was coming from as a a first responder who just didn't know what to do anymore. He just wanted people to start making good decisions, right? And acknowledging that he had to get some information. He had to learn and accept really what he probably already had been taught, but he had to accept that addiction is a disease, that it's not a choice after a while. It might have been a choice the first couple times to, like right now, I'm choosing to take a sip of water, but after a few thousand sips of something, maybe my brain no longer gives me the real choice. I'll just be drinking that water without even realizing it. And oh, it's because the disease is taken over. So I know that this is sometimes a tough topic to talk about, but the reason I like people to hear Josh's story is because he got the information, he changed his thinking about addiction. And then instead of quitting or going away, he actually took on a whole new job as a prevention specialist so that he could do even more work in this area instead of running away from it. And so I think this is a good reminder for all of us that uh, it's not an easy job to care about people. It's not an easy job to stay caring, but you can get through it and there are other people to help you. So that's why we shared that story, and some of you, it may resonate with some of you, and I hope it does. And there are other stories of other ropes on the Tennessee site, so when you go check out his story, but you can check out some others too, and I think it's really exciting. The takeaway is that select a judgment-free strategy. Meet people where they are, and you're going to save their life, right? And make sure you use evidence-based strategies as well when you do that. So just showing up is good, but showing up with something that works is even better. All right, next story. If my slide advances, there we go. My next story is a cool example of something that is data-driven. It's public health action. It was conducted by the South Carolina Overdose Response Strategy Group. And once upon a time, before the pandemic, the South Carolina Governor's Opioid Emergency Response Team began weekly calls. And they were doing these weekly calls because they had these new data on board, which allowed them to monitor drug overdoses at the state level. And within about a month of doing these calls, looking at this new data source, they were able to improve their ability to respond with local partners to identify hotspots and mobilize resources all over the state, particularly in rural areas. And we all know that that's a big issue, right? Because what works in a city does not necessarily work in a rural area. But it all started with the data. So remember, I was going to highlight data a lot. You need numbers, right, to make a difference. In early May of 2020, the team noticed that there were this unusual number of overdose events reported by their first responders in the months of March through April compared to like usual. And this was occurring in rural Marlborough County in South Carolina. The team also noticed that overdose events were clustered in specific areas. So this wasn't like a random kind of spike. It was in certain little areas, and they even mapped it. You can see that's a tiny little map on your screen, I bet, but you can see they had a little heat map, and that comes from their data dashboard. Their data system also showed that there was geographic and demographic descriptive data associated with these clusters. So they kind of knew who generally by like age, sex, race, etc. And it also allowed them to track these events over time. So they were really able to get a handle on when these events were happening and kind of to who. So armed with these data, the State Department of Alcohol and Other Drug Abuse Services reached out to a local behavioral health provider, Trinity Behavioral Care, and they were the local county treatment authority for that county plus a couple of other rural counties around South Carolina. And they shared the data from their dashboard, and they said, you know, this is where it's happening, when it's happening, who it's happening to. And within a day, Trinity Behavioral Care reached out to a local faith-based organization, which they partnered with in their community, and they got the word out via a media campaign. They did all the organizing necessary to host a drive-through Narcan distribution event. This is within one day of hearing about these hotspots. Now, you can see a picture of some people holding the signs from that drive-through event. Remember, this was during the pandemic or just before it, so people had masks and it was outside, so there was social distancing happening. But the event was really notable because not just the people they invited showed up, not just people from the community, but some other key, political partners like the sheriff's office, the superintendent of Marlborough County showed up, a district house representative showed up, the chairman of the county board of education showed up. So this pilot event got so much attention and distributed so much Narcan and so much information and drug deactivation bags. The Deterra drug deactivation bags are pictured there. That it's already been used multiple times around the state of South Carolina as a model to address hotspots. And it encouraged additional training for law enforcement officers on how to administer Narcan. So again, making sure that you have access to this drug. That's a picture of it there. It looks like an upside down kind of letter Y or something, that little white thing. That is the Narcan, the naloxone for reversing an overdose. So just know that with a little bit of data, you can plan an event that can make a difference in people's lives. Now, events like this, I think, are an important example for all of you because it's an example of a partnership between local coalitions, law enforcement, public health, all working together. And I want you to ask yourself today, do you know somebody from each of these groups in your community? Like, oh yeah, maybe I know officer so-and-so, but I don't know anyone in public health, and I don't know anything about coalitions. Or maybe you're in a coalition, but you don't ever talk to law enforcement, for whatever reason. So whatever that is, you need to know someone from each of these groups and you need to have regular contact with them. If you don't already, then that's some homework for you. I challenge you to do this. Like, build your own little coalition in your community. Start small, start with one person in each of these groups and see how far you can take it. Now, this story also shows the importance of data. You can learn more about the system that South Carolina used. It's called ODMAP, and it provides access to near real-time data from first responders, right? So these are people going out who respond to those 911 calls. And these data essentially link EMS, law enforcement, public health. You can learn more about it here and see if your state or your locality has any connection to these data. But the state of South Carolina is a great example of using them for action. Now, also, I will point out that you can learn more about our national overdose response strategy, which is really designed to enhance the public health and public safety collaboration, that law enforcement and public health, making that partnership real specifically in 21 high intensity drug trafficking areas across 34 states. So there's a little map here. You can learn more about this project. It's CDC funded as well, and SAMHSA is involved. I just want you all to remember that there are a lot of people working on this. If you think you don't have partners, then I need you to look a little harder because we're all over the place. Now, the activity was a key part of the South Carolina Opioid Emergency Response Plan. And the reason the state did this was because they had nearly 5 million opioid prescriptions filled each year. 5 million prescriptions filled each year. That's more than one prescription for each person in the state. So South Carolina had a problem, and maybe still does, but right, that's why they made this plan. That's why they started using these data and making partnerships, right? So don't wait till your problem is this big. There are some other resources that you can check out. Their campaign, Just Plain Killers. The URL is listed on this slide. I encourage you to check that out too, because they have put so much information about opioids and overdose prevention online, made it accessible to families. It's not all designed just for public health professionals. It's not all designed just for doctors, right? Go check it out. Share it with your kids. Share it with your teenagers, right? They're essentially young adults who can take this stuff in. I encourage you to check it out. Justplainkillers.com, fantastic resource. And the takeaway is for you guys, families and communities especially, is that collaboration is your best strategy, right? And I will say, because I'm in public health, use data to drive those activities. But if you don't know your partners yet, like I said, that's your homework. Go find 3 different partners in your community: public health, law enforcement, and a coalition member, right? Maybe you're one of those 3 already. So your homework is a little easier. Third story. Third story I have for you is a pretty neat example of a prevention program in North Carolina. And I'll say it's neat because I think it involves sort of a non-traditional partner, a group we don't usually think about. It's a SAMHSA supported program that is through the NC State Extension and 4-H, which is the largest youth development organization in North Carolina. And if you haven't contacted your local 4-H, then I encourage you to do that as well, because 4-H is pretty impressive. Now, the Empowering Youth and Families program, that was this program that was developed, it focuses on opioid prevention education for youth and their caregivers in rural North Carolina. Now, their goals are fourfold. One is just to reduce youth substance use, not just opioids, but substance use in general. It's to improve parenting skills. And if we do those first two things, their third goal was to improve family relationships, right? Because if you reduce substance use, improve parenting skills, families tend to get a little healthier. And then finally, let's take those healthier families and give them the tools and skills they need to lead change in their communities, right? So aspirational goals, but they were making it happen, and I'll tell you how they did it. The way that they did it was they created a curriculum which were 10 weekly sessions for families to participate in. At the end of those 10 sessions, a family retreat was held, and then all of those families that did the retreat joined together from different counties, and they designed a community outreach event so they can go and make an impact in their community. Before the pandemic, all of these weekly sessions, which included like an in-person for youth, separate from in-person for the parents, they also had interactive community events and education and activities. All of that was in person. It all culminated in a community action planning event where they all went to the one location, and they used an activity called community resource mapping, which is cool. You can see some of the images here where they got technology and they got flip charts out, and the families would work together, identify all these different local supports, and they would create a resource guide for their community working together so everyone knew where to go for help. It's pretty great. 4-H, just to support these families after the fact, put all of these free webinars online, which is really exciting because guess what? These webinars are available to you guys right now. You don't even have to go through this whole program to access the support materials. They are there online for all of you guys to go watch. So you can see what the families got as support, which is exciting. Now, what I think is most interesting is that then the pandemic happened. And remember how I told you that these are real world examples. And the reason I like to pick these is because there's no excuses for not making this work. In summer of 2020, because of the pandemic, they couldn't meet in person anymore. They couldn't go to those 4-H camps anymore for the retreat. So they created the Powerful Families, Powerful Communities curriculum. It was based on adverse childhood experiences research, and it promoted objective protective factors. And that's exciting because, right, there's a distinction now. We have the Empowering Youth and Families program, which is that overall program, the 10 weeks, the family retreat, the community education event, which were all designed to be in person. But now they have this curriculum, which is free, which is available for you guys, the Powerful Families, Powerful Communities program, all of that content, but it can be delivered virtually, completely virtually, or hybrid. They adapted it so that it can be delivered anywhere by anybody at any time, right? No excuse not to have this in your community, not to be doing this. And it's free, which is even better. So I like to highlight this story because people say, well, I'd love to do something, but we don't have any money, or we don't have a place to go, or we're rural. Well, guess what? They made it happen even during a pandemic. So if you're curious how they did it, you can get some more information on this slide right here. There are a number of links. They love to have people reach out to them. I encourage you all to check that out because there is no excuse. The take-home message from that final story, that third story, is really rooted in the social determinants of health, like what we know is important. And I summarize it by saying place matters, which means prevention is really building the healthiest families and family environment possible, right? Positive childhood experiences create positive, healthy communities. Also, we all know what works in one town does not always fly in another town, right? Every organization, every individual, every community, every state, every region has unique strengths and unique challenges. So we need solutions that fit families wherever they are, and that can only be created by the families from those communities, right? We can give you the tools to make them, but they're going to look different depending on where you are. So place really matters when it comes to saving lives. Now, that said, talking about specific and unique circumstances, I want to flag one resource that's really important that sometimes gets overlooked. It's this GRASP organization. And it's a wonderful resource for families who are coping with a death due to an overdose. Many families have no idea where to go, or maybe they only have one or two places they can go and they're not getting their needs met. Maybe your family doesn't need this resource. I hope it never does, but maybe someone you know might need it. So take note of GRASP. It's a fantastic resource for wherever you are in the country if you're dealing with a death, or if you know someone who is. So that said, to help you find other solutions that work in your communities, I'm going to wrap up my talky portion of this day by sharing some HHS resources, some Health and Human Services resources that you guys have already paid for, right? So your tax dollars at work. These are things that you've already created or paid to have created. And so now you just got to use them. And let's talk about it. So in my opinion, maybe the first and best resource that you need to know about is SAMHSA's treatment locator, which is pictured here. So it was recently updated and it was improved. Once upon a time, there was a findtreatment.samhsa.gov and a findtreatment.gov. Now, if you type in the one with SAMHSA in the title, you'll just be redirected to findtreatment.gov. It is a new, improved, all-in-one site for finding treatment when you need it. So that's important. Also, everyone get out your cell phones. If you don't already have this number programmed as a contact in your cell phone, do it now while I'm talking. It's okay, I will not be offended. Go ahead and start typing in your cell phones. Normally presenters don't like you on your cell phones when they're talking, right? Do it. Whether you need the national helpline or not, doesn't matter. Someone you know might need it. And wouldn't it be great to just have it right there as a contact you can share? So 1-800-662-HELP, right? Write it down, save it, share it. Next resource, at our SAMHSA store. You ought to just go and poke around our SAMHSA store anyway, because it's fantastic. But you can find our 2020 national guidelines for behavioral health crisis care, right? These are guidelines that establish the standards for crisis care if you're looking to improve this element of your local response or your community response to crises. We also have published some national youth guidelines recently, so those are there. Go check that resource out. Maybe national guidelines are a little much for you. You're like, I just want to have a conversation with my teenager. Fact sheets. We have a number of free fact sheets on any number of topics you can name. If you don't want to go to the Talk They Hear You site, if you don't want to go to any of the other resources we've listed, just go grab some random fact sheets. Like, you know, this one talks about meth. So stimulants and meth are still there. They're a huge problem. Just because we're talking about opioids today, mostly, doesn't mean we're ignoring the things like marijuana, the things like meth, the things that are still creating big problems in our community. By the way, fentanyl is in all of that. You know, just don't think fentanyl is just being laced with opioids. It's, you know, it's being found in marijuana now. So yeah, the drugs are being mixed and matched so much now that you really need to have these conversations and get the facts. So get informed, get some fact sheets. And my goodness, if you don't already have one of our SAMHSA apps, go download an app. I like the disaster response app that's pictured in the upper corner here. It has psychological first aid components already built into it. It has a number of other resources for folks dealing with disasters. If you live in a disaster-prone area, I encourage you to check that out. Now, I do want to mention a specific area about schools resources, because if you work in education, you know it's kind of a special environment, right? We have even more stuff for you. Now, in general, our evidence-based practice resource center is your one-stop shop for everything we know that works, right? So here you can see it's listed. You can go find all of our stuff there that we know has scientific evidence supporting it, and the treatment locator is listed there too. But in addition to that, with all the current anxiety and issues about returning to school and staying in school, with COVID still running around and all of that, and mass shootings, etc., our mental health technology transfer centers have focused on children and youth and mental health. They've all received a number of lots and lots of dollars, additional funding every year. So if you want to find out more about what our mental health technology transfer centers are doing, you can go to their website. You can use this QR code to subscribe to their newsletter. And just as a for example, MHTTC network, our Mental Health Technology Transfer Center network, has worked with the National Center for School Mental Health to create a couple of curricula, like the classroom WISE, which is WISE is an acronym for Well-Being, Information, and Strategies for Educators. It's a 3-part package that helps educators support mental health in the classroom. That has been developed and is available for free. We also created the National Student Mental Health Best Practices, which is implementation guidance. That curricula has been downloaded over 4,000 times since 2021. So if you want to learn more about things that are working in schools specifically, go check out our MHTTCs. And finally, here are a few ways that you can connect with SAMHSA more directly or SAMHSA-funded technical assistance, because those are all sort of reference material, but these are things that you can reach out to and get a response via email or get a real human. So I mentioned the MHTTC, right, the Mental Health Technology Transfer Center, but we also have addiction and prevention technology transfer centers all over the country. These used to be once upon a time just for SAMHSA grantees, people who had applied for and gotten a SAMHSA grant, but now it's anybody in the public can go to these websites, download their trainings, download their resources. Some of them have contact information so you can reach out to them and get questions answered. Find one in an area near you. There's this awesome like virtual display booth thingy that is pictured here on the slide. It's clickable and it allows you to go all over. Now, a specific kind of technical assistance, the rural opioid technical assistance centers. We have our regional one at Florida State University now in Region 4. So, but there are ROTA grantees all over the place. So for assistance specific to opioids, you can reach out to them. I think that's really exciting. Or maybe you're a clinician. Maybe we've got a few docs or social workers or nurses here on the call. If you're a clinician seeking guidance or mentorship or training, maybe contact our provider clinical support system. Or maybe you're part of a community that wants to make a difference specific to opioids, and you could reach out to our National Opioid Response Network. They have a form you can fill out, and within about 48 hours, a local expert will reply to your request for information or assistance. They can't actually apply for funding for you, but they can guide you and respond, like they can like review your application materials too. So they're a fantastic resource if you're thinking about trying to get a grant. Now, if you're not really sure who your partners should be or are in your community, I encourage you to connect with the National Network to Eliminate Disparities in Behavioral Health, or the NED. It's free to join. Go to their website, sign up. Once you have access, you can see a map, and it's a network of all the partners and people working in various different topics in your area, and they will probably like that you reach out. So there's also free trainings with CEUs, webinars, resources available. So if you're not part of the National Network to Eliminate Disparities, go ahead and join. Why not? You have nothing to lose. Maybe you work with uniformed service members. Maybe you are a uniformed service member. About 7% of our population is either a uniformed service member, a veteran, or somehow associated with a uniformed service member. So consider getting involved in our governor's or mayor's challenges. These are put on by SAMHSA's service member, veteran, and their family TA center. They train local community leadership teams to identify veterans at risk of suicide. And so this is a fantastic prevention effort. It's not specifically related to opioids, but it is an important activity in your area and could be a meaningful activity for you. So altogether, kind of as I begin to wrap, I want to make sure that you understand that you can make a difference and you can save lives. And there's some simple principles that you can apply to do that. First principle is just meeting people where they are. So come at this in a judgment-free manner, right? Don't should on people. You have to accept where people are and get them the help that they need. The easiest way to do that is by collaborating with people in your environment. Don't do this alone, right? And you need to use strategies that fit your family or your community, right? So some things are going to work in your community and some things are not. Make sure they're evidence-based. Go to our evidence-based practice resource center and find what fits best for your family and community. And to make it even easier, you know, we've got networks that are producing these same resources or more resources for you. So reach out to those networks. I want to challenge you. to consider what resource you're going to reach out to either today or tomorrow. I've listed so many, and you're going to get these slides, right? So there's no excuse not to reach out, or at least just go browse through a few websites. Now, that said, you should know that SAMHSA has a network of regional administrators. I'm one of 10. There I am down in the little corner of this slide. That's me in Region 4. We are your federal BFFs when it comes to behavioral health. My job is to be out to see you guys in your natural habitats, to come and visit, to come and help you solve problems. So that said, here is my email address. I hope you guys use it. I want you to make sure that you take a screenshot of this, write it down. The hardest part of getting in touch with me is spelling SAMHSA correctly. Make sure you get the SA and the MH and the SA in there. And with that, I think we're going to transition to the Q&A portion. I'm going to turn it back over to
Awesome.
Michelle.
Great job. Thank you, Captain King, for all this information. You're getting lots of positive reinforcement in the question queue, along with questions, but a lot of thank yous, and appreciate the information. They love the fact sheets. The program examples, they're going to be sharing those with other coalitions in their area. So we're getting a lot of positive feedback along with the questions.
Good deal.
So let's kick right into, let's see here. What do you see as the responsibility of schools other than having Narcan available on the school site? How do you see schools could potentially help?
Yeah, schools are on the front lines. They're first responders. They may be the first folks to notice that there's a problem. You know, kids, depending on the ages, you know, they may or may not uh, feel, you know, like they have any other safe place. So, and be cognizant of that. So I will say that a school is just a microcosm of the community, and schools need to be able to respond to an overdose. They need to be providing education. They need to be a trusted source of information. They need to make sure that they're linked with the community. SAMHSA has another grant program called Project Aware, where we fund schools to do brief modules on mental health and behavioral health education within the classroom. And so kids are kind of pulled from the classroom and then put back in. And so they don't miss a lot of curricula during the day, but schools implement this differently all over the country. But a school is absolutely a location for continuing education and awareness and health promotion. And the idea that we can just ignore these problems is not realistic, right? We know that kids are vaping in class. You know, we know that kids
Right.
are exchanging things in schools. So
Mhm.
we've got to carry the message there.
So I know that you're in and out of a lot of different states. You have 8 states that you represent in your position. Would there be a school that comes to mind that is really utilizing the Project Aware education tool well, or a group of schools, or just for us to have sort of a model, a role model?
Wow. You know, well, so there are many that are doing a great job. The one that I like to talk about a bit, and you know, I like to share these stories. The one I talk about is, I believe it's the Seminole tribe in Florida, and they had a school that served a super wide range of kids. I'm gonna get it wrong now because I don't have my slides up, but it's like from really, really young to like maybe middle school age, I think. And they got a Project Aware grant. They competed, they're competitive grants, and they had to go up against like the state and a bunch of other big
Oh,
organizations to
that's
get this
awesome.
grant. Yeah, and they did, you know, they just did a neat one of the activities I'll just share that I thought was miraculous is they had this ball, right? And this is obviously for like one of the younger age classes, but it had different statements all over the ball. And when the kid caught the ball, they had to read the statement and then answer it. And one of them said something like, I get nervous when, and then they had to finish that. And uh, like some little kid, some, you know, maybe like 5-year-old said, I get nervous when I'm outside because an alligator ate my dog. You know, it was like, this is
Mm.
Florida, remember?
Yeah, that's
Um,
Florida, right?
so, you know, just like,
Scary. Yes.
but you know, this is how you get kids to start talking about their feelings, and you have these conversations, and you have to start having conversations. Like, that's the beauty of things like the Talk They Hear You campaign. Talk They Hear You funds youth, funds students to do projects within their schools, by the way. They have funded some teens to do an awareness event within their school. So they've given them money to develop materials to go and do an event in their school, which is fantastic. So there are just lots of opportunities out there.
Yeah, that's a great example. It's incredible. So someone else asked, how do we identify signs if someone is using, especially one of our own family members? So I think they were asking for specific bodily signs of use. And I did want to mention we have a really great webinar with Arlene Rice, a couple of them that goes really deep into those signs. And
Yeah.
so I was remembering, like, she was teaching us about smaller pupils, and you can chime in on the ones I missed, but I'll rattle off a couple. Shallow breathing or drowsiness. She gave us an example of like actually dozing off at the dinner table, some of those things, and significant weight loss,
Mm.
maybe a lot of sneezing. So that would be like the opioid working its way out of the system.
Yeah.
So it's almost like flu-like type symptoms, and maybe itchy, like itchy skin, a lot of itching, were some things that she had mentioned as specific signs to watch for.
So I'm going to be first I want to say, families know families the best. And so if you suspect it, don't be worried about, is that the right sign or the wrong sign? If you suspect something, have the conversation, follow up. Don't just go, oh, I'm not sure that's the right sign, you know. And denial is always easier, right? Like, you're going to want to believe it's just the flu, or it's just, oh, they just have allergies or something like that, or they just didn't sleep well last night. But you have to be radically honest with yourself. I don't want to give out medical advice, because sure enough, I'll list 5 symptoms and someone will have a 6th symptom, and they'll be like, well, King didn't list that symptom. You guys know best, right? And it doesn't cost anything to have the conversation, to ask. You've got to ask the question. You've got to do some poking around. As a parent of a youth, you have the right to poke around too. And, do some detective work on your own, but ask the questions, ask them, have the conversation. There, there is no one universal sign that somebody is using or misusing substances, because there are so many different substances out there. But in your gut, from their behavior, from probably a constellation of behaviors, what to look out for. I
You're
mean,
absolutely right. That parent intuition is a powerful thing
trust
too. I
it,
think you start to know something's off, maybe even before you see signs like
trust it.
this, right?
Yeah,
Trust
trust
it.
it. You have to trust it. And honestly, like, the only medical advice I can say is, if someone's lips are turning blue and their breathing is stopping, then that is an obvious, like, medical emergency. Doesn't hurt to Narcan them, because it's not going to do any harm otherwise. And of course, call 911. That's, you know.
We had a lot of specific questions about Narcan,
Oh.
and one of them was, can I still use it if it's outdated,
Yes.
expired?
Maybe I'll lose my job on this. I want to share a story. I'm going to share another story because I love stories. Uh, I was in Where was I? I was in Mississippi, and I was at the grand opening of a new medication-assisted treatment program, and the medical director there, who just came on board, uh, who'd been, in the field for a long time. He had an expired box of Narcan in his truck, of a couple doses, um, that he had forgotten about. And he was driving to work one day, and he saw somebody passed out on the side of the road. He pulled over to see if he could help him. The police pulled up almost simultaneous with him, and they knew him because it's a small community. And he was like, "Hey, I think that person has overdosed. You better dose him with some Narcan." And the cop was like, "We can't. Ours is expired." The cops were expired too, and they refused. They were like, "We're told we can't do it. We just got to call the ambulance and wait for him to get here." And this medical director, who knew that, like, this person is not going to survive, they were not breathing. They said, "All right, well, you start CPR." and I'm going to go to my truck. And he ran back to his truck and he got his expired Narcan. And sure enough, one hit in the nose there, one squirt up the nose. The person sat bolt upright and started walking across the parking lot. So the cops had to go track him down and reel him back in and stuff. But and the doc stayed until the ambulance got there in case the person needed a second dose. But that, despite being expired, it still had an effect. It probably wasn't as strong an effect. Like, we know that things past their expiration date tend to lose efficacy, and you obviously want to have current stuff. But by all means, if there's a chance of saving someone's life, yes.
Yep, from the parent perspective, and just a citizen, I would say let's give it a shot. It's not going to hurt the person. They're not going to get too much Narcan, from what I understand. So,
Yeah.
if you have it, I would, I personally would try it if I had it in my
Yeah.
hands.
Well, and I'll say this is Michael King's opinion. SAMHSA may have an official standpoint on that I've never looked up, and it probably is the federal government probably has never used expired medication, I imagine. But I will say, as social worker, public health service officer Michael King, I'm going to be like, as a parent, 100%. And
I
like I said,
agree.
anecdotes from the field prove it.
So
So
a parent asked this question too, and I've had this cross my mind. How do you know, like if you're on site administering Narcan, how do you know if someone needs two doses? Is there any particular sign,
mhm.
or
Yeah,
how do you deal with if it's the first dose is not working? Maybe
you,
how
you
long do you wait in between? And
you wait until medical help arrives, and if their breathing starts to stop again, or if their respirations clearly are decreasing, that means the effect of that initial dose of opioids was so much that just one dose of Narcan wasn't enough to knock all those little opioids off the receptors. So um, yeah, it'll be very obvious because they'll fall out again. They will stop breathing again.
does it work on other substances other than just opioids?
Opioids. No, in
Only
fact,
opioids.
this is a big deal. Thank you for this question.
It's a good question.
because
Yep.
yeah. So I mentioned, I made a quick mention of like the zombie dope, the horse tranquilizer, xylazine, that is now being mixed with fentanyl to bulk it up, to bulk up counterfeit pills, to bulk up other stuff. And the Narcan has no effect on xylazine, and xylazine will kill you just as well as fentanyl will. And what's sad is that, yeah, I just was reading a story in the Times about Philadelphia and how xylazine has saturated the drug market in Philadelphia. So now, like, the value of every dose of Narcan in Philly has just gone way down because there's this powerful animal tranquilizer being cut in with the fentanyl. And what's even
Mhm.
scarier about it, I think why they call it zombie dope, is because once you've used it, it creates wounds that are like scaly and yucky, and often, like, the wounds, if they're not treated soon, will require amputation. So people are losing limbs because they've been using drugs that have xylazine in it, and they're the wounds that are erupting from that site of use are requiring limb
Oh
amputation.
gosh,
It's just terrifying. Yeah. So
so scary.
if you really want to be terrified, like, Google xylazine and see what people are. Like I said, there is no recreational use anymore. And
Hmm.
what's even more is that a lot of the kids that are dying aren't recreationally using. They're like, oh well, I just thought I was going to borrow an ADHD pill from my friend because I've got ADHD pills and I have the same, but I don't have them with me. And that friend actually got a hold of counterfeit pills, and it has fentanyl in it. So
Yeah, that's exactly right. I mean, the audience is just so thankful that you went broad on this presentation, even a little bit further than opioids, like we're discussing now. I mean, it's so frightening. Someone gave an example that they were glad that you mentioned marijuana and fentanyl because they lost a student, and so as a teacher, I'm guessing with their first time smoking at college and just you know just passed out in the parking lot.
yeah,
So it's just such a widespread problem, and it's it's huge, and it's
Yeah.
there's a new factor with this every day. So just continuing to dig at it. And then one of our prevention providers reminding us that their work is always upstream, and so they're tackling marijuana, alcohol, and tobacco to concentrate and get folks to stop early use of these substances so they don't progress to anything like opioids. So I thought there are a lot of prevention providers that are um,
Yeah.
working at it from that angle as well. We appreciate you all so much.
Yeah, and I'll even go a step further than that. When I think about prevention and public health, and I think about building healthy communities. So it's not just about maybe enacting policies that limit availability of alcohol or other substances. It's, or even education, or I think about the idea of walkable streets, of food security, like having access to that, having access to supported employment and shelter, and all of these things that we know make for a healthier, better, closer knit community are going to build healthier kids, healthier adults, and keep everyone connected, because the opposite of addiction is not sobriety. The opposite of addiction is connection.
Good point.
And if people are connected constantly, they're not going to get addicted. It would be really hard to get addicted. Let me put it that way, without someone noticing and without someone intervening. So
You might have
increase
said
the
this on
connection.
your list of resources too, but we talk a lot about in our local community coalition about transportation.
Hmm.
So in terms of connecting people to the services that they need, medical and otherwise, out in the community to be an important piece of that wheel too.
Yes.
So I
Yes.
see where you're going with that. It's so true. And if
Yeah.
someone's connected, their mental health is better, like community wise. Like there's just so many things that work together for the good in what you're
Yep.
saying.
Oxytocin. That's what it's all
Yes.
about.
So one of our other prevention providers, let's see, let me get back to my other question. Okay, yes, this is an overdose prevention coordinator for a public health department. They're
Mhm.
trying to collect the OD map
Mm,
like South Carolina is, but they're struggling to get law enforcement and fire to partner in the exact way that's needed to do that.
yeah.
Would you have any suggestions?
Yeah, so you might look to see, I don't know where exactly you are, but if you're in one of those high intensity drug trafficking areas, to see if there is a HIDA team there. So it's a two-person team that's funded for each one of these, for each state in one of those areas. And it's a public health and a public safety expert who work together to improve access to resources that'll prevent overdoses, et cetera. And so they work both supply side and demand side. And uh, they are often very helpful in negotiating those relationships if you're in an area where those relationships are challenging. Also, if you are in Region 4, contact me, and I'm happy to come on over and chat about ways to negotiate those relationships and build some bridges and or thaw some ice. If you're in another region, then consider reaching out to your regional administrator. That's why we're here. And we know this is all about relationships, and it's sometimes there are some other things involved, but ODMAP is a if there's funding there, then there's very few reasons not to access it unless there's some misconceptions about it. And so not every place has the current resources currently, but that doesn't mean you can't have those relationships to get that going once the funding is available.
Great point. We did include the contact list of all the SAMHSA regional directors on the list with the handout with the links on it. So that may be helpful to the whole audience too, to have that
Yeah.
um, resource right at your fingertips. So another person asked, so in terms of what's happening to educate medical providers on opioid addiction,
Yep.
Have you seen some good resources there?
Oh, well, so I mentioned our provider clinical support system. So that's we give lots and lots of money to these folks to support docs and nurses, and allied professions in approaching this from a clinical standpoint. So there's that. Up until recently, we supported a waiver system so folks could prescribe opioids to fight opioids basically via medication assisted treatment. And we provided ongoing continuing education to support those folks who want to help battle addiction but aren't really confident in their prescribing some of those FDA approved drugs to fight addiction. And so SAMHSA has a great investment in educating docs and nurses and others. And really it's interprofessional. So in Region 4, we brought together folks from every one of the 8 states as well as all of the medical schools around the Southeast to talk about how we build this into their curricula, either at the medical school level or at the residency level or beyond. So also developing new fellowships. I think that I could talk about this a really long time, but yeah, provider clinical support system. Just go check that out, PCSS.
Is there
And
anything that a person who knows that they're going for surgery, like a
mhm.
painful surgery, is there anything that an individual can do to get prepared for how to talk with their doctor about the treatment afterwards? And
Yeah. So 100% be your own advocate and explore alternatives to pain control, like opioid alternatives. So I'll just say, like, I am one of the people who was prescribed opioids following a dentist visit, and I didn't even have that much pain. I just had a toothache, and I went in, but I got a prescription for a whole little bottle of these things, and I was like, wow, that was crazy. And they didn't even ask me what I wanted. I just got this prescription, and I was like, oh, look at that. It's a whole bunch of opioids, and there was no
wow.
discussion, there was no chit chat, and it was not my usual dentist. And I was just like, wow, that's really interesting. But this happens every day, all the time, just like in what South Carolina, we hear 5 million prescriptions a year. They don't have 5 million people in that state. So
Mhm.
this happens all the time. You have to understand that so many substances have an addictive quality. I mean, heck, Afrin, right? Like you can get addicted to Afrin. Don't use a lot of Afrin. But like knowing going in that you may have to experience a lot of pain, there are many alternatives now. Docs, trust me, they don't want to be the next headline. You know, if you have the conversation with them, and if they're not 100% like receptive to exploring alternatives to pain control, then you probably need to have a second opinion, because there are no docs who want to kill people. They don't want to.
Mhm.
I mean,
That's
well,
exactly right.
yeah, most all.
Yep, not why they go into the business, right? That's
Not
exactly right.
not
Well, hey,
not
we're gonna
most.
double check the queue for a couple more questions real quick. While we do that, I want to let folks know a couple things about Operation Parent and what's coming up next. So, in our elementary and middle and high handbook, we cover the tough topic of drugs. Even fentanyl is already mentioned in our elementary handbook to help parents get ahead of everything that they need to be talking about to their children earlier and earlier, it seems like. I think you would agree with that. So, if you already have a copy, we'd love for you to go to those pages and just refresh on the content that we have provided there to help you parent or in your community use that information. And then we also have a couple of special offers today for those that are with us on the webinar. We want to let you know parents, grandparents, foster parents are all really enjoying our handbooks and utilizing them regularly. If you're here with us today, you get a special opportunity. We don't often have the offer go for an individual handbook or a bulk order, but today it does. So if you want to hop over to our website and see what we're talking about, check out our newer elementary handbook or our middle and high. You could get 15% off of either with using the code winter 15. It's a tight close on the offer, so you'd want to do it pretty quickly. That is going to close up on February the 10th. And you can go right to operationparent.org/shop and check it out. If you have one, you might even consider getting a different edition and maybe sharing that with your extended family. I know I have shared them with sister-in-laws and brother and whoever I can think of raising loved ones close to me, just to protect the full tribe. Um, and if you have any questions, we have awesome community advocates on our team that know how schools, drug-free coalitions, and churches are utilizing our handbooks and other prevention tools out in the community. So if you want to talk with someone about some of the ways that the handbooks are being utilized across the country, we would love to do that. We also want to let you know we mentioned the behavior modification webinar coming up in March. We also have one on vaping that will be on April the 25th. So hopefully you could join us. For any of you that have seen a past presentation with Dr. Aaron Weiner, he's coming back again and going to dig in on vaping and what our teens need to know about that. And so, Amanda, I was just going to ask you if you were able to see any additional questions in the queue. But first, I'll let folks know our social media communities are growing a little bit every day. Facebook, Instagram, LinkedIn, YouTube. You can find us in all of those arenas, and we hope that you'll join us and join our community there. So lastly, I was just checking to see if we missed any questions. I know we didn't get to everything, but I think we got to the majority. Did you see any others, Amanda?
Yeah. Uh, can you hear me, Michelle?
Yes.
Okay. A lot of people really did want a couple of clarifications on Narcan, so I just wanted, and naloxone, just wanted to make sure we clear those up.
Great.
Wanted to go again. It's correct that if you don't know if someone's overdosing and you use naloxone or Narcan, it will not harm them if they're not overdosing. It can
Correct.
only help.
It can only help. There is no harm done. Trust me. Yep.
Good, good.
In fact, don't trust me. Go to read our SAMHSA toolkit, and it'll mention the extremely low risk of dosing with Narcan for any reason. So, yeah, if you see if you see blue lips, if their respiration is almost not there, they're struggling to breathe. Like if they've got any of those signs, like yeah, you cannot go wrong using the Narcan. All it does is get rid of opioids. So if there are no opioids on board, no harm, no foul.
Okay. And then do you have to get certified or trained in order to carry around naloxone and administer it?
Not certified, but I will say many states will ask that you sit through a brief orientation to learn about the signs of overdose, how to try to revive somebody without using a drug, the things that we just went through based on the toolkit. So as a for example, so Michelle, where I met Michelle, the representative from, I believe she was from the state, or was she from the Prevention Coalition? I can't remember.
Shelley Steiner.
Yeah, so she showed up,
Mhm.
gave a brief, I think it was a 10 or 15-minute orientation to what we talked about today, and then had people sign out and distributed free Narcan to people in the community. So
It was
while
quick and easy, but it's
yeah,
important to know exactly like how to use it, when to use it.
yep, yep.
Yep.
And honestly, it's like just having it available. Like there are going to be some times when you're almost, it'll be fairly obvious like that it's not an overdose. Like someone clutches their heart and they fall down in front of you, then you're like, oh, it's probably CPR time, but it's probably not an overdose. That said, if you see someone struggling to breathe, they're really shallow breathing, their lips are turning blue because they're not getting air, it's like, well, yeah, so you having some training can help you. It's more for the people responding to feel confident than others. frankly, if you come upon me and you don't know why I'm unconscious, please Narcan me, just in case, and then do CPR too. Like,
Mhm.
why take a chance? But yeah, no, there's no certification needed though.
Okay. And then someone asked about fentanyl in marijuana, and also is there fentanyl in vapes?
Yeah, so you can vape stuff with THC, right? And like it only the amount of fentanyl that is required to be deadly, it will fit on the head of this pen, right? Like if you think of the ballpoint tip of this pen, less than that amount of fentanyl is potentially deadly. So yeah, it is being vaped, it is being smoked, and as we heard, sadly, people are dying from this, because the way it's being laced, it's not like a pharmaceutical that you would get at your pharmacy, right? That's not measured carefully. It's not evenly distributed. So imagine this: like you share a pill with somebody, or you share um, something else, some other way that you're using, but they get the part with fentanyl and you don't. They die, you don't. But it's all from the same source. Maybe it's in gummies. It's like CBD gummies. Well, that CBD gummy might not just have CBD. Like it's like if I get the paw with the fentanyl in it and you get the paw without the fentanyl in it, I'm dead. You're not.
That's
Thank you, God.
exactly what we referenced in our last webinar, and we have a video. There's a local young adult, Wyatt, and who passed that way, taking he and a friend both took from the same batch, and he passed and his friend did not.
Yeah.
And so I would just encourage, I mean, we learn something new every day. Unfortunately, this is a really tough topic to learn something new about, but an important one in the same. So we've got Wyatt's video up on our website if someone wanted to watch that, or maybe watch the full fentanyl webinar from January. I would say rewatch this one a couple of times because you're going to learn something new. I think every time you listen to it, um, we we had a lot of questions last time about like the um, compressions versus breathing versus like responding, and so I am still learning something every time we talk, and I just went to YouTube on that and said, how and when is it appropriate to administer naloxone? And there's some really great YouTube videos that you can watch quick and just kind of get your confidence up. So I would say, if you're like me and you're still learning but you want to help if needed, to just watch a couple of those YouTube videos and get your
Yeah.
confidence up.
And American Heart Association, if you're concerned at all about like rescue breathing versus compression only CPR, everyone should go and take a CPR class. They're free in many places, and so especially if you have anyone who's 50 or older, like in your family, or if you're even going to hang around me, just please go, because who knows,
Just
you know,
yeah,
like I want someone to
yes.
save my life sometime.
That's exactly right. And that's why we started this adventure together to put this webinar together. We were hoping that people will take away some nuggets and save some lives with what we're talking about.
Yep.
So thank you so much for all your time and
Thanks a
your
lot, Operation
experience
Parent.
across all these states and sharing it with us. We appreciate you so much. And thank
Well,
you
it's a
everyone for
pleasure.
joining us today. And we'll see you on our next webinar. Talk to you soon. Thanks.